Hello, and thank you for joining us for today's hybrid education program at Cancer Support Community South Bay. I'm Rebecca, the program manager, and I welcome you to this workshop titled Sex After Menopause. Before we begin, if this is your first time joining us, CSC South Bay's mission is to uplift and strengthen people impacted by cancer by providing support, fostering compassionate communities, and breaking down barriers to care. Our vision is that everyone impacted by cancer receives the support they want and need throughout their experience. We serve the South Bay, Long Beach, Orange County area all at no cost. Our program includes support groups, networking groups, healthy lifestyle classes, social activities, and educational programs like this workshop. Educational programs are open to all. If you'd like to hear more about our services or join a community, please visit our website at cscsouthbay.org. Before I introduce today's speaker, we ask you to keep your microphone muted for those online to eliminate distracting background noise, but please feel free to enter any questions into the chat function found at the bottom of the Zoom window. And then for those in person, we can get to your questions at the end of the presentation. Without further ado, I'll introduce our workshop speaker. Dr. Sarah Shimanek is the co-owner of a private physical therapy clinic, Akasha Physiotherapy, located in Long Beach. She is a board-certified clinical specialist in women's health physical therapy and is certified in pelvic rehabilitation. You can check more out at our website, akashapt.com. Thank you so much, Sarah, for being here with us today.
Let me go back. Resume. Okay, I think I'm here. Yeah, good. Okay, can you all hear me? All right. Well, welcome everybody that is here in person and online. So today our topic is about sex after menopause, or just any sort of circumstance that has maybe caused you to have decreased estrogen. So there we go. This is just a little bit about me, PT, specializing in pelvic floor, breast health, women's health. And today, so our agenda is pretty simple. We're just going to, there's sort of three main categories of changes that happen after menopause or decreased estrogen that affect our sexual function. So we're going to talk about those three different categories and then just some strategies to deal with each one. And then some links and resources for, more support or some of the things that we talk about. So, and then we should have a little time for questions at the end, hopefully. So those three different categories are just the changes in the tissues that happen, right? Thinner tissues, less lubrication, those kinds of things. Physiological changes, changes in arousal, desire, and then nervous system and muscle changes we're putting kind of in the same category because they play into each other. So it could be weakness, tension, or changes in the nervous system that are creating pain responses. So we're starting with tissue changes. Probably one of the things that maybe we're most familiar with that has happened after a decrease in estrogen. But we have this lovely picture to see what really happens in the vaginal lining. So you can see when we have more estrogen, those walls are thicker. And then also something to note is that it's got this like kind of curvy sort of thing, right? That like in that vaginal wall, we can see it on there. It's called rugae. So it's these like little folds that help it to stretch, right? That's there originally mostly for the purpose of like babies coming through there, right? It has to stretch like a lot. But it helps with any sort of activity that's going to require stretching, right? And you can see that after estrogen, we're not really getting so much of that anymore. So not only is it thinner, but we also don't have these lovely folds that really help to give us more stretch. And in addition to that, we have less elastin, less collagen. So just the nature of it is going to not stretch as well, right? And that's something that happens to skin and everywhere else too, that we notice. some of that with age, but then it's amplified when we have a sudden decrease in estrogen. And so it makes it more prone to tearing, right? Um, because of that tissue being thinner, because of it not stretching as well. And so that can cause a little bit more pain potentially. And then on top of that, we also have an increase in pH. So it's less acidic, which might make more prone to infections and less lubrication. So a lot of things going on in those tissues that are not great for participating in particularly penetrative intercourse, right? So what do we do about that is then the next natural question that we have. So we have this lovely slide that's a little overwhelming. Probably should have split this up a little bit. But there's some different categories of things, right? Some stuff being focused on the tissue integrity itself, right? And of course, for some people, that natural answer is vaginal estrogen. Obviously, that's going to depend a lot on your particular circumstances, particular type of cancers that maybe you have had, and whether or not that's okay. Increasingly, we are seeing oncologists being okay with that because it doesn't not get so much into the rest of your system. And so a lot of the research that's come out lately has said that even with an estrogen dependent cancer, that it's still okay, but that's just totally going to depend on the oncologist and would 100% be a conversation with them about your specific situation. But obviously it makes sense that if we add some of that estrogen back, that we're going to actually gain a little bit more of that, tissue integrity back, right? And so it's something to at least consider or have a conversation about, right? It's also not going to make it perfect. None of these things are. It's really all about finding the right combination of things that make it possible for you to have the experience that you want to have, right? Another alternative that actually does help to improve the tissue is a DHEA cream. So DHEA is a precursor to estrogen and the other sex hormones. And just FYI, Rebecca has a PDF of these slides. And so if you want them, you can ask her for them. And goes for the online people too. So DHEA, precursor to estrogen, other sex hormones. And so there are creams that are just over the counter, not even prescription, that you can get for that. And it can help to have some of the same effects that estrogen might. But without, generally, it's considered to be a little bit safer and not as high risk as estrogen itself. I still would recommend, especially if you have any sort of estrogen-dependent cancer history, that you have a talk with your oncologist about that before going out and buying it, even though it is available, over the counter, right? But just knowing that that's an option out there that might be a little bit safer might be something to consider, to have that conversation. If we're not comfortable with any sort of, estrogen-based or hormonal sort of cream, or that's just not appropriate, then there's other options, right? Vaginal moisturizers and then suppositories too, that basically the same as vaginal moisturizers, but in a little different delivery system, right? And that's sort of, I think it's important that we separate that out from lubricant too, right? These are different things, and sometimes they get a little bit confused with each other. So the vaginal moisturizer itself, it's kind of like lotion, right? That you just put on preventatively to try to help, those tissues, just like you would if you were having dry and thinning skin. You do the same thing, right? So that you just do on a regular basis, not necessarily anticipating sex, right? Or anticipating penetration, but just to sort of help keep things a little bit more moist. A lot of them have hyaluronic acid in them or other sort of things that are still going to help to plump up those tissues a little bit. And, so those are things to explore that are perfectly safe, have no hormonal implications, but can still have a really good effect. And really different ones might be better for different people, right? Everybody's bodies are just like a little bit different and might respond to things differently, So sometimes it just takes a little trial and error to see which one feels the best. I've given a few examples of brands here on the slide that I just have had people have success with. I have absolutely no affiliation with any of these things and no, stake in any of it. But just to kind of have a place to start if you're looking for some of these things, Replens is one that's pretty frequently recommended by a lot of OBs, but there's a lot of other ones out there. Good Clean Love, Ah Yes has some good ones. And then suppositories, there's a newer one that's come out, and they have one that has CBD in it and one that doesn't, but both have hyaluronic acid and things that actually goes up into the vaginal canal and then gives it time to kind of soak in, right? I feel like that gives even a little bit more than just putting a little bit of cream on there, right? So, all of those things can help. Again, nothing's going to be the like, oh, this one thing completely fixed, everything that's going on, but all of those things can be helpful. And in addition to helping with the tissue integrity, a lot of those things can also help with lubrication and even desire to some extent, especially the hormonal ones or the DHEA. But even the other ones, if the tissues down there are a little bit healthier, you're going to get a little bit more blood flow, and that's going to help with the arousal responses too, right? So, it's not just about the tissues too there. And then I'm sure that some of you have heard of, I mean, there's a bunch of different like medical procedures that maybe some of your doctors have talked about. There's laser treatments, radio frequency, shockwave, PRP, right? We're not here to talk so much about those or get into a lot of detail about them. All of those I would put in a category of they can work really well for some people, and then for some people, they don't do much of anything. Um, and they're all pretty expensive and not covered by insurance. So if it's generally, if you want to try something like that, it's an option that's out there in conversation with your doctor or whoever might be, the provider that is giving those procedures. All of those are about trying to actually stimulate the cells to be a little bit thicker, to proliferate a bit so that those walls can be a little thicker, can be a little bit stronger, right? So all of those in different ways are trying to target that. So, with the idea being that it's actually improving the tissues and is not just kind of a band-aid on it. So it's interesting stuff that's there. And if haven't heard of any of those, it might be worth talking to your doctor about some of them and see, or do a little bit of research. Then we have the lovely category of actual lubricants, right? So remember, we're separating those from the vaginal moisturizers. So the lubricants you're using during some sort of sexual activity, whether penetrative or otherwise. And there's different kinds. I will say, for most people, once you've had that decrease in estrogen in those thinner tissues, some of the water-based ones can feel a little thin or feel like they dry up really quick, right? So a lot of people really like silicone-based or oil-based ones. Oil-based is even giving a little bit of moisture to the tissues too, while also giving lubrication. And then the silicone-based just kind of sits on top of the tissue and doesn't get absorbed, which means it can last a little longer, which is nice too, right? So, I mean, one of the ones that's really popular silicone-based is the Uberlube. And then for oil-based, so a lot of people just use coconut oil, right? Easy to find and cheap and, all of that. And I have mixed feelings about it, I'll just say. So it's good and it's safe and it's fine. The only sort of little caveat and hesitation about it is that coconut oil also has antibacterial and antifungal properties, which sounds good and maybe is good. But if you have kind of a delicate flora in your vaginal canal, which some people may just be a little bit more sensitive to changes there, and we're introducing something that's antibacterial, then we might kill some of the good stuff, and change the ratio there for the negative, right? And so I'd say a lot of people use it and are totally fine and don't have any problems, But if you're using coconut oil and then you get a yeast infection or something like that happens, then you might want to steer away from it next time, right? So that's the only kind of thing to be a little bit careful about coconut oil. Some people really love it. Um, and of course, it's easy to find. The other note on the water-based lubricants is that some of the more popular ones that you get in the drugstore, like KY and Astroglide, have parabens and glycerin in them, and even some other things in them that are actually drying to your tissues. So, you know, that's obviously not quite what you want, right? You're using this lubricant for the purpose of, that individual activity, but then we don't want to leave those tissues drier than they started. So I, I think it's better to look for something that's a little bit cleaner, a little bit more natural in their ingredients that specifically says it doesn't have parabens or glycerin in it. And then just in general isn't quite as complicated, doesn't have a bunch of stuff in it that you don't know what it is, right? So just kind of keep an eye out for that, because a lot of people just, those are the ones that they've used before and that's what they know and that's what's available, right? So again, there's a few brands there that you can kind of take a look at and see if any of those, but there's also about a million different lubricants out there. So it doesn't mean that these are the only ones that are good. These are a few that are pretty good, but there's like tons and tons of others, right? That are also good. So you can take a look out there. Yes.
Question online.
Yeah.
For the silicone one, wouldn't it be bad to have silicone in your body?
It doesn't get absorbed by your body. So, did they hear the question there?
Yes.
Yeah, okay. So since it doesn't get absorbed by your body, that's why it's considered okay, and that's also why it works pretty well. So, but I mean, again, some people are, if you're concerned about that, then don't use that one. But as far as we know, it's perfectly safe. Is there another question?
Yeah. Is it bad to use expired lubricants? It's like you said, wiggle room.
Yeah. It maybe depends on what it is, right? For most water-based lubricants, I can't imagine what's in there that really expires. An oil-based one, I'd be concerned, right? That's a little bit more, there's something in there that maybe could go bad. Silicone, I also can't imagine what's in there that expires. So use your best judgment there. I would probably still use it, for me. But I mean, if it's like 20 years old, maybe not, you know. But if it's like a few months past its expiration, I can't imagine that that's bad. But use your own judgment. The other piece I just wanted to mention in this category about sort of supporting those tissues is just doing what you can to support your body and its production of collagen and elastin, which is drinking lots of water, lots of protein, bone broth, collagen. There's no evidence that taking collagen specifically leads to more collagen production in your body, but it's just different ways of getting those amino acids, right? So whatever works for you in your routine, whether it's actually just eating more protein, drinking bone broth, or adding collagen to your coffee or tea, I think all of those are good ways to support that. Lots of leafy greens. Those have a lot of the nutrients that we need to produce collagen and elastin. And in addition to that, and kind of crossing with that, is foods with vitamin C and vitamin A, because those are also necessary for collagen and elastin production. So citrus, peppers, tomatoes, sweet potatoes, carrots, pumpkin, right? Just some examples. Because that's going to make sure that you actually have the building blocks and the tools necessary to improve those tissues, even just in addition to these other things, right? If you're doing some things that are supposed to help stimulate, but then you don't actually have enough nutrients in your body for your body to grab, right? Then it's not going to have as much effect as it would if you are eating a little bit more variety in some of these things, right? And then, I mean, good sleep and managing stress is always just like we heal better when we're in a position where our body's not stressed. It's hard to heal or improve something if we're stressing out our body, because that's going to then divert our body's attention away from trying to heal our tissues and to whatever it thinks the problem is or the stressor is. So just some general things that also can be helpful that we might not think about. All right, moving on to the next category of things is our nervous system and muscle changes. So I put these on the same slide because I feel like they go together. There are some muscle changes that are directly related to the decrease in estrogen, like a little bit of atrophy, right? And weakness. That's directly attributable to the estrogen. But some of the muscle changes, which can be tension or difficulty relaxing, are going to be a secondary effect if there's any pain. That's how your nervous system is responding to pain. So if we have these thinner tissues that have then caused a little bit of tearing during some sort of, sexual encounter or other encounter, then our body, our brain becomes more sensitive to things happening in that area. It wants to protect it, It says, oh, there's a threat here, something is bad. And so we need to protect this area. And so it turns up the volume on the negative kinds of sensations, right? On the threat receptors, and we get a little bit of a heightened awareness. And so things that aren't even actually tearing or causing damage might start to cause pain, because we have increased our sensitivity. And along with that, then when there is some sort of pain, then our muscles guard up to protect us. They're trying to, close things off so that we're, not prone to having those tears or that damage that our brain thinks is going to happen, whether it is or not. So those two things then kind of feed off of each other, right? Because then the increased muscle guarding and muscle tension causes more pain in and of itself. And then it just kind of feeds itself in this lovely little maladaptive loop and cycle that has to be interrupted in order for you to heal. And you can't ignore one side or the other side of that when you're trying to fix that. So, and it also, engages this more fight or flight kind of response in our body, where we're diverting blood flow now away from our muscles and, getting more cortisol and a stress response, which is also bad for healing, right? So, then this category of things, there's a lot of stuff that we can do. So, I'm going to start with the thing that I put at the end because I think it's the most important, is that continuing to just engage in penetrative intercourse, if it's painful, is gonna make it worse. It's going to reinforce that cycle that keeps happening of then muscles guard, more pain, it makes it worse and worse. And then your brain is anticipating in any sexual encounter, it says, oh, this is bad. And then trying to find pleasure in that situation, maybe not, right? It's not going to be there because your brain is just sensing threat, right? So it's a bit of a process to kind of undo this cycle in our brain. And, everybody is going to be a little bit different as far as what tools work. So we're just going to talk about a few things that generally are helpful. If it's been there a long time, or pain has been there a long time, generally some sort of support, from a PT or somebody trained in that is going to be the best way to move forward. But there are some things that you can start to try on your own, especially if it hasn't been happening for that long and maybe that threat response isn't as ingrained in your brain, right? So one of the things is vaginal dilators. So have any of you heard of vaginal dilators? No, a couple nods, but mostly shakes of your head. Okay. So there are these, there's a picture on the slide there, but then I have them here for the, so they start really little, right? For most people after menopause, they don't usually need to start with the the little guy there. But basically, they start little and then they graduate, bigger and bigger. And you're using these as a way to both stretch the muscle, but also provide kind of a graded stimuli. So to start to push the nervous system a little bit to say, okay, this is a little bit uncomfortable, but it's actually okay and it's not causing damage. And that helps to reset that threat cycle, right? So the dilators kind of do both of those things, They get really big, and I don't know if I'm gonna pull out the biggest one because they're kind of scary. But now I said it, so I have to. Yeah. So not everybody needs to anyway, but but basically, you start with one that's not super threatening, and you use that, but you just insert it, right? These things come with instructions too, and I think they even have videos and things as well. And then of course you can work with a PT about exactly how it should be used for your own body. But you're inserting these. This is obviously purely for penetrative pain. But you insert it, one that's not super threatening, and then you just graduate to higher and higher ones so that you can let your body adapt and stretch both your nervous system and your muscles, So it's a tool that can be really helpful for that. So and those are readily available. There's tons and tons of different ones of these too. So, not necessarily attached to any particular brand. But in addition to dilators, in the same vein, there's also pelvic wands that can be used for just more like active stretching, through that area. That's best used in coordination with a PT who's told you what to do, because you can kind of hurt yourself with this a little bit. So just be cautious of that one. Another one that I like that's come out more recently, that's specifically for penetrative pain, is this device that's just external, right? So getting to some of the muscles that are just more on the outside, and then it can just go a little bit on the inside to kind of stretch the opening area. That's sometimes just a little bit easier to implement and is a little less threatening for you and your body, and can be a really good place to start. So, and again, I have links to all of these a little bit later, and they're in the PowerPoint. So, if you want to check them out. Another tool for during any sort of intercourse penetrative activity. So there's these little rings. This is called a O-nut. And basically, so if the pain that you're having is with deeper penetration, that is more, if that's what's more painful, then this is basically limiting how far your partner can go in, right? Without decreasing their sensation. These are really like soft and flexible, and you can add as many or as few as you need, together, depending on what's painful. So it's kind of a cool little thing that somebody came up with that can just be a way to still engage in an activity without, having pain, right? So there's just a lot of different things out there. And obviously, something to note here too, if all of this stuff exists, there's a lot of people that are having this problem. Yeah. So, because again, these aren't even the only brands or the only things, that are out there, right? So I think sometimes it's just a little bit comforting to know that there's other people going through some of the same stuff, So, so there's a lot of stuff out there. Also, something that can be really helpful for people to experiment with is pillows and wedges. Think about different positions that maybe allow for different amounts of penetration or come in at different angles. Playing with that a little bit can help to just be in, like the pillows and wedges specifically help the muscles to relax a little bit, right? So that can be helpful. And there's a lot of different ones out there that are actually made for this, but then of course, you can just use like pillows and things that are, whatever. So, that's something that might be worth exploring as well. In addition to all of those kind of physical tools that exist, anything that helps you to be more aware of or notice or relax those muscles or relax your nervous system is also going to help to break up that cycle, right? Of the nervous system and the muscles and the guarding and the pain. So diaphragmatic breathing is a really good tool for learning how to relax those muscles if that's not something that you've tried before. It's basically taking a deep breath in through your belly, letting your belly expand, and kind of imagining your pelvic floor muscles dropping or opening. I know a couple of you have like been in my presentations before, and we've probably practiced that. So, but that can be a way of letting go of learning to let go of those muscles. And actually doing that is sort of an exercise, daily can help train your brain of how to even do that, how to relax those muscles so that when you're in the moment in a sexual encounter, it's easier to access that pattern because you know it really well, right? Because that's obviously when it's going to be the hardest to try to relax those muscles, and you're trying to overwrite this like fear response too, if there's been any issues in the past. And so the more that you've practiced that and the more that you've noticed whether your muscles are relaxed or whether they're, tensed, the easier it's going to be to access that program, in our brain of how to do that in the moment, right? But that is hard to do. It takes a little bit of practice. The actual accessing it in the moment, I mean. Though actually it's kind of hard to do and takes a little practice just in general. And then, yoga type stretches, meditation, mindfulness, even though that's all sort of general, just help train you and your body and your nervous system to know how to relax as well, right? So that you can access that in a moment of fear that might come up, so that you're not guarding in those moments. I have a big question mark next to Kegels, because the answer is maybe on whether or not that's going to be helpful. So if the biggest problem is that your muscles are really tense and tight and you're guarding a lot, then Kegels are probably going to make that worse. Yeah. And so if pain is your biggest issue and you really can notice your muscles guarding a lot, then that's probably not where you want to start. Yeah. On the other hand, in order to have a really good orgasm and arousal, we need those pelvic floor muscles to be strong. And we need good blood flow to them. And Kegels can help with that. So it sort of depends on where you are, It could be that, first you need to focus on relaxing those muscles a little bit just to make penetration or intercourse possible. And then once you've learned that pretty well, then you could work on strengthening to kind of make that experience more pleasurable and maybe make orgasm more likely, right? So, but if you're somebody who's not currently having pain and maybe the biggest obstacle is more arousal and orgasm and those kinds of things, then maybe Kegels are a decent place to start. The best person to help you figure that out would be a pelvic PT. But if you can kind of think about where you're at in that cycle, that might kind of give you an idea as well. So, and then remember, don't push through the pain because then we're reinforcing that cycle, right? Yeah, we just, not that like doing that once would be the end of the world, but if you're repeatedly over and over again engaging in an activity that is causing you pain, then your brain is going to learn that that activity is painful, and then it's going to anticipate pain. And then it's going to make everything worse. So just keep that all in mind. So as you're going through. All right. And the last fun category is some of the physiological / somewhat psychological changes that are happening around arousal, desire, and orgasm. So, I mean, everybody is different and bodies change through time anyway, and what feels good and what doesn't feel good, what's arousing, what's not arousing is going to change anyway. And then definitely after hormonal changes, that's definitely one of those things that can trigger some of these changes. And of course, it's super common to have slower arousal, less of that spontaneous kind of desire. And a lot of changes around orgasm and how long it takes, the intensity, how it's achieved, or whether it's possible at all, you know? Well, I'll say it is always eventually possible if you, work at it, right? It's not like you get to a point where that's just never a possibility. But it might be so different that you're not able to access that right now in this moment, right? And then changes in just what feels pleasurable, what feels good, what doesn't feel good, definitely are all super normal things to happen around that time. And that requires a little bit more individualized kind of approach, right? That's a lot of kind of trial and error. But the first thing that you want to do if you're noticing some of these changes and you're not really sure, what even works anymore is really to try yourself first, right? It's good to explore with a partner, and we'll get to that in a second, right? But when our body has changed and we're not even really familiar with it anymore and what those reactions are anymore, practicing yourself, and seeing what works for yourself is a really good place to start. Because how are you going to communicate what you want to a partner if you don't even know what feels good anymore, right? So taking a little bit of time to do that, I think, is a really important piece of this. So, what kind of stimulation, works? Is it clitoral stimulation? Is it penetration? Or is it something else? I've done some talks and worked with some people with like strokes and spinal cord injuries. And some of them who have absolutely no sensation or anything below the waist have figured out how to orgasm and how to get pleasure from like completely different areas of the body, like from their ears or their neck or their, other things that they've, been able to find pleasure in, and then even can orgasm and have a pleasurable experience with a partner, So if that's possible for them, then there's a whole range of things open to us, right? That don't have that big of a limitation. And opening our minds to that a little bit and knowing that there are other ways out there to achieve what we're trying to achieve, I think is really important to keep in mind. And then exploring that on our own a little bit, right? Not being too afraid of vibrators or toys or things, right? A vibrator can be a really, really good tool after menopause, even if it's not something that you used or were needing before, right? Because that's giving a more powerful sensation than you can achieve, with just the human body alone, right? And so if you haven't experimented with some of those things, then this is a good time to do that, yeah? And then you can notice what feels good and what doesn't feel good, so that then you can go to the next step, which is exploring some of these things with a partner. That journey has to start with communication, and we're not always real good at that, are we? um, how many of us that have been like in relationships for decades are regularly talking to our partner about what we like and don't like in a sexual experience, I think there's a lot of us that are not having that conversation very regularly, or possibly haven't ever actually had that conversation. And so, you introduce that. And if that's new to you and new to your partner, then you start that by saying, at some other time, not during or after or before a sexual experience, by the way, some other time, neutral time, you say, hey, there's some stuff I'd like to talk to you about, about our, sexual experiences and sex life. Hey, would you be available and interested to talk about that after dinner on Friday, right? Like, set an expectation that at this time that you're going to have that talk. Don't spring it on them, especially if that's not something that you're usually, you know, having these conversations. And then at that time, you know, open up that conversation. And of course, that should be a two-way thing, you know. You're communicating what you want, but you're also listening to what they want so that you can put those things together, hopefully, right? Certainly one of the things that most likely needs to be communicated in that time is that most women after menopause or decreased estrogen need longer for foreplay, like significantly longer, you know, than what your partner might be expecting or might be used to, probably, right? It just takes, I mean, this is probably just true in general for women, actually, but even more so after, you know, these hormonal changes that we've experienced, right? And, you know, it just takes a little longer. For one, it takes longer for women to get out of their head and into their body, right? That's the across the board part. And then it takes longer for those, you know, for your body to respond, you know, and that's the more hormonal piece of it, right? And so not only communicating that you need longer, and I would suggest that you put a little bit of a time frame on that so that your partner has some idea of what you're talking about, right? Not just like, oh, I need a couple minutes instead of one, you know, but like I need 20, 30 minutes of just touch and, you know, just being next to each other and, you know, whatever that is. And, you know, so that we can really ease into this. Yeah. So, you know, no, don't just say, I need longer, you know, set real clear expectations about what that means too, right? And then one thing that I would really suggest as you're exploring some of this together, particularly if you have any history of pain or there's ever been pain with penetration, you might consider proposing to your partner that you have a shared experience that's not goal-oriented and or that's not penetration oriented. Like just taking that off the table, not forever or anything, just for that time so that you have an opportunity to explore things that are not that, right? To see what feels good with each other. And even taking, you know, a goal for orgasm off of the table, not that you can't do that part, but like to not even have that be part of the goal that we have to get to this place can really take some of that pressure off. And especially for you, right? If we've developed a little bit of fear around this activity because of a previous history of pain or tearing or discomfort or whatever the thing is, then having a time where you're not even, you don't have to worry about that. You know that that's not on the table. You know that that's not there. Can help reset your expectations, your brain and your body's expectations about sex just in general, to instead of saying, oh, this is something I need to be afraid of, oh, this is maybe something that I can enjoy with this person too, right? You know, so, you know, that's something to potentially put on the table, right? And then the other thing is, if you were finding as you were exploring on your own that there were certain toys or vibrators or particular lubricants or pillows or wedges or whatever that were helpful, then definitely talk to your partner about that. And it's okay to bring those things into your partner activities as well, right? So, you know, even if they've never been there before, and even if that sounds, you know, a little bit foreign. So just opening up a little bit to the idea that things can look different, but still be really good, you know, and that it doesn't just have to be this one goal that we're trying to achieve and that that's it and that that's the only way to have a pleasurable experience, you know. And it doesn't mean that if you have that goal that you can't get there, because you can, you know, pretty much everybody can, but it's just to say, you know, hey, my body's a little bit different, things are a little bit different, because you want it to not just be, you know, if the goal is simply to achieve penetrative intercourse, but there's nothing about pleasure in that statement, then I'm not sure that you're really serving yourself, right? And so you want to make sure that you're incorporating that other piece. And I think that this part is an important way to do that, and to think about that. And then you can absolutely introduce penetrative intercourse once your brain and your nervous system and your muscles are ready to do that, right? And it will be easier to do that if you've found ways to get your body into a place where there's desire and arousal and even, and pleasure, right? So those are some things to think about around that. And then I think that's most of what all I have. I have all the links here for some of the stuff that we talked about, which is again just kind of for your information. I have no, stake in any of this stuff, but just because, there's certain things that some people have found helpful, and these are far from the only things that are available for that, but there's some resources. One that I think I didn't talk about that's on here is there's a site, omgyes.com, that if you haven't done a lot of exploring around different ways to achieve sexual pleasure or different ways to ignite that in your body, that's what that site is about. It's a research-based site that can kind of talk you through or give you ideas or things to do. That's not not in a porn related kind of way. It's very it's educational. Yeah. omgyes.com.
Yeah.
And it's here. Oh, I didn't talk about it before, but it's on this list. Yeah. So, that's a safe place to go to kind of get some of that information. That's not too scary. I also put on here a link to a site that has a bunch of different types of vibrators. That's also not a super scary place to go, if that's not a thing that that you've done a lot of before. And they have a bunch of different options that are pretty good for if you haven't done much of that before. So, so just for your reference, those are there. And then that's all that I have, but we can open to questions.
Wonderful.
Yes.
When using a product like Replens,
Mhm.
is that something that you use daily or only like before intercourse?
Yeah, so the question was, when you're using a product like Replens, is that something you use daily or just before intercourse? That one's meant to be used more on a daily basis, but also I believe they do say you can use it as a lubricant as well. So that one can kind of go both ways. But it is intended as a vaginal moisturizer, more like, again, the lotion kind of situation that you just put on a little lotion every morning, Yeah. Any other questions from in here? Okay, do we have something?
Yeah, or they only want access to the pain management link, but I can put that into the chat. But if there's any questions online, feel free to put it in the chat, or you can direct message me as well.
Mm-hmm.
All right, let me
I
see.
know it's sometimes hard to ask questions about this particular topic.
Yeah, so and I think this is such a, you need such a safe space and be so honest and give us such dignity. It's important.
Yeah.
That we talk about this. So there is a question. What about Reverie?
Reverie.
If it was super expensive, if you have to use it
Use it
regularly.
Yeah. Yeah, I mean, that's just one of the options out there. I don't know that it's any better or any worse than any of the other similar products that are focused on that tissue health. So if it's feeling too expensive for you, try something else, Yeah.
So are there any other questions in person or online? For those online, please feel free to put it into the chat, or you can direct message me as well. Wonderful. Well, thank you so much, Dr. Shimanek, for being here with us and talking about this important topic with us.
Yeah.